Namaskar. This is in continuation with the series we have started, that is Paratantravalokan. So far we have seen some 2-3 examples related to Mimamsa Shastra. Now I am taking you to one another knowledge system, that is Kamsutra. First thing we will discuss is why should we refer to Kamsutra? The answer is very simple, one liner, but we'll discuss it. See, Kamasutra has many taboos or some distort glorification. People, the ignorant people rather, I would say, they think it is a soft porn. It's not that thing. It is completely scientific document. Highly oriented, highly precise, and even today scientific world can call it a scientific document. Anyway, question is, why should we refer Kamasutra? First thing is, Ayurveda surely has described so many things about physical relations of a male and a female. But the perspective is mainly towards Santanotpatti. We can see in Vajikaran or say Swasthavritta, we have a lot of rules and regulations about the physical relations. But primarily they are focused at Santanartha Maithun. This term is used by Kalidas in the Raghuvansha, Sarga first. He says, Vrittyartham Bhojanam Yesham Santanarthancha Maithunam. The great kings of Raghuvansha, they had only enough food to keep them alive, and they engaged themselves in sexual relationships only for next generation, that is to develop santana. So they were so committed, and the Santanartha Maithun is well described in Ayurveda. But in Vyavahar, in clinical practice, and all over in around us, we see the relationships between male and female, physical relationship, is hardly limited to Santanartha Maithun. In fact, it has been seen that not only humans but other animals also engage themselves in sexual relations for enjoyment. Rather, it has been found that healthy sexual relationships between a couple plays a vital role in married life. I am sure you have also seen many patients who have such issues. And these issues have many aspects. First thing that in this lecture we will discuss one physical aspect, only physical aspect. And another consecutive lectures we will discuss some other aspects. So the physical aspect today we are discussing is about the length and the breadth of the sexual organs of both male and female. You can see in Ayurvedic text, Charaka and Sushrut, they have described the length, breadth of Medra and Yoni. That is alright. You can see Sushruta has said that Rasva Medra is Dirghayu and Dirgha Medra is Alpayu. You have all the references. You can see on this screen also. It is from Sushruta. Again, this is totally individualistic. But when it comes to the couple level, it comes at the couple level, the individual is just a subset of that total set. He is not total alone, he is part. So you have to present as a couple, you have to have one male, one female. And there comes the issue of compatibility. Now we will be discussing the issue of compatibility at the length of organs. As we have said, we have seen that Ayurveda has given the length, breadth of organs, Medra and Yoni. It is okay. Again, just as said, that is for an individual. But Kamsutra describes the length and breadth at some qualitative measures. It is not quantifiable, it is sort of qualitative. I'm sorry, I should use the subject subjective. It's not qualitative, it's rather subjective. It's not objective parameter, it's subjective. You can also see that Sushruta Tikakar has resolved the issue of objective parameters of the length of Ayurvedic text and subjective parameter length of Kamasutra length. He has resolved that issue. You can see that on the screen. Okay, so we'll go what the Kama Sutra says. Kama Sutra elaborates 3 types of Medra. It is Shasha, Vrusha and Ashwa. Shasha, Vrusha and Ashwa. And it is said that the Shasha is 6 angular length, Vrusha is 9 angular and Ashwa is 12 angular. That is an erected Medra. Uchraya, the word used by Sushruta is Uchraya, erection. So the Shasha is 6 angular, Vrusha is 9 angular and Ashwa is 12 angular. So this is typology of male organs, subjective parameters of described by Kama Sutra. There is difference of opinion about the diameter, but that is hardly our discussion point. So let us keep it aside and go ahead. Now comes the issue of female organs. About the female organs, Kamsutra says it is Mrugi, Vadava, and Hastini. Mrugi, Vadava, Hastini. And that is Mrugi is 6 angula, Vadava is 9 angula, and Hastini is 12 angula. Mrugi, Vadava, and Hastini 6, 9, and 12 angula. That is you can say it is vertical length of the yoni, vagina. Now, here we have 3 types of male with respect to their length of the organ, and we have 3 types of females with reference to their length of their organ. So now compatibility matrix, if we draw, you can see on that matrix that the matrix describes when it comes to Mrugi and Shasha, it is good. When it comes to Vadava and Vrusha, it is good. When it comes to Ashwa and Hastini, it is good. Other are slightly inferior level. And when it comes to Shasha and Hastini, it is the most inferior. And when it comes to Mrugi and Ashwa, it is the most inferior. Whatever we are discussing the compatibility during the physical act. Again, I'll tell you, you can see the matrix on the screen. Here, the Shasha having compatibility with Mrugi is, we can say, grade 1. Vrusha having compatibility with Vadava is grade 1. Ashwa having compatibility with Hastini is grade 1. Shasha having compatibility with Hastini is the inferior grade. Ashwa having compatibility with Mrugi type of female, it is again the most inferior thing. And likewise, you have the matrix, you can see. This tells us about the physical compatibility. Now, I'm sure you have seen some patients complaining about their compatibility during physical relations. There are certainly some mental issues, akama, anyakama, all are described in Ayurveda. But when we actually examine the patient with due respect to that patient and with due ethical everything paraphernalia in your clinic, you can actually find out if there is such type of incompatibility, that is Shasha and Hastini or Ashwa and Mrugi, etc., etc. So that could be your diagnosis. Again, this is not only diagnosis, but you can see Kamsutra or Anangaranga, they have described so many physical relation positions, and those positions are to overcome this incompatibility. That is, if the male is Shasha and the female is Vadava or Hastini, there is going to be incompatibility. So how to overcome that? So Kama Sutra describes certain positions to overcome that. Or it could be the reverse case. The female could be Hastini and the male could be Shasha. Or the female could be Mrugi and the male could be Samurusha or Ashwa. So in that case also there is incompatibility. And Kama Sutra and Anangaranga and all that text, they do describe certain positions of physical relations to overcome that issue. This is one thing. So when the patient comes to you for such describing incompatibility during the physical relations, you have to examine them for their own swasthya and you have to examine them for compatibility. This is only physical issue. And then accordingly you can guide them for appropriate positions of having pleasure or whatever. And you have to also follow the basic regulations if they are following the Santadartha method. This is one thing. Another thing is, you have also gone through the Yoni Vyapat Samasya and even the problems of male genital organs like Klabya and all that. There you can see that certain issues, Ayurveda has described problems, but the hetus of that problem, that is for certain Yoni Vyapat or typical Klabya, this assessment could benefit you. I'll not go into details right now, but you can refer the chapter of Yoni Vyapat, Charak Chikitsa 30 and Klabya, and there you can see the description. You can, back of your mind, you can have some relationship with, can correlate with this Shasha, Vrusha, Ashwa and Mrugi, Vadava, Hastini, and then you can find, yes, there could be some Utpadak Hetu or Vyanjak Hetu of either of male or female for that Yoni Vyapat or even Klabya Hetu. So this is its utility. So now we will stop here. In next lecture, we will be discussing some other aspects that is mainly related to quality of sex. Thank you.